I'm just doing a little reading over the coronavirus pandemic here, and this is a highly recommended orthodontic textbook by two UK orthodontists, and I found a section of interest that's talking about adult orthodontic treatment, and somewhere, I don't know, on the bottom here, it says in children and adolescents, orthodontists should always aim to treat the malocclusion definitively. In adults, treatment should primarily address their complaint. So, treatment may range from simple upper and lower arch alignment, blah blah blah, all kinds of different choices. So anyway, so that talks about orthodontic approaches, different ideas for adults versus kids, and then it goes into cover short-term orthodontics. So here it goes. It says last few years have seen a huge rise in the advertising and promotion of what has been come to know as short-term orthodontics. These are essentially techniques designed to align the front teeth while accepting other aspects of the malocclusion. So that's kind of a one definition, I suppose, but there's also the short-term orthodontics that addresses the whole person's skeletal and dental situation. But so there's ways to shorten even orthognathic surgery, but then there's also ways to shorten comprehensive orthodontics, which wouldn't include treating posterior crossbites and some minor AP issues. So anyway, so this particular definition is just talking more about the cosmetic ortho popularized, as it says, with a certain brand here. So it says it can be done with clear aligners, removable or fixed appliances. The Inman aligner in a removable appliance with a labial bow and lingual bow activated with the Nitai springs. Fixed appliances such as the 6-month Smile provides pre-adjusted brackets in trays, and it goes on to say what else? The techniques have primarily been marketed as general dentists and as a way to improve a patient's smile aesthetics without recourse to expensive and destructive restorative procedures such as veneers and crowns. So they at least address the topic that now general dentists can offer a less aggressive treatment choice than just drilling the teeth straight and making them look straight with porcelain, which is again very harmful to the teeth, and many teeth have died and been actually lost because of that instant ortho technique popularized by the cosmetic dentist type of practice. So case selection is important, as these techniques are unsuitable for anything other than mild crowding when more than just tipping is required. Well, again, these are two orthodontists that are a little bit pessimistic about the abilities of general dentists, so we'll just say that, okay, that's their opinion, but probably a little wider range of treatment is possible with some kind of neat alternatives with combining composite bonding to deal with worn teeth and also do a little straightening at the same time. Case selection is important. Upper and arch alignment of anything other than very mild crowding will almost always result in some increase in overjet. Well, this, if you do some IPR or slenderizing the teeth, it addresses the concept of making the teeth all stick out. So that's again just one version where you don't even deal with the width of teeth, and often teeth are too big, or there's teeth that are too small and could be bonded up and aligned as well. So again, not a true definition of what is currently going on in the marketplace, but again, it talks about that it is a alternative. And what else does it say? Let's see. Other than that, mild crowding, patients invariably committed to permanent retention in either arch following short-term orthodontics. Well, in any orthodontic treatment, the patient has to be committed to permanent retention. So there's anything special with short-term ortho. Well, if you have braces for 2 or 3 years, you're still walking out with a bonded retainer and one that's removable, and you're supposed to wear them for life. So this is, again, they're just picking on this approach because mostly it's general dentists doing it. Let's see. Whilst there's certainly a place for this technique, it is important to note that patients must be aware of all the treatment options available to them. So at least they're saying there's a place for this technique versus, some places like Alberta, Canada, the lawyers say, well, no, you can't even advertise this technique. You can't even tell patients that orthodontics can be better than choosing veneers or crowns in some circumstances. So the word police here are really ridiculous. But anyway, it says, again, it's an alternative, something to know about, and you have to tell the patients, okay, there's other alternatives, and that goes with any type of treatment. And you have to make sure they know what they're getting, and again, most patients understand that they're wanting mostly cosmetic improvement half the time, and if that's what they want and that's what they get, that's fine. And they've already mentioned that is kind of what you want to do, is address the patient's complaint if you're an adult. So anyway, great article. The dental authority lawyers will not want to see this because it makes them look like they're wrong.